Congratulations! You have made it halfway through your life. This is the time to make your health a top priority and not take your body for granted. Preventative healthcare ensures a healthier life as we mature. One filled with energy, activity, vibrancy, and a positive outlook on life. As we age, so do our organs and every part of our body. Prevention and early detection are key to healthy golden years. This is the time when we trade youth for wisdom, and with wisdom comes good decision. A healthy life is your decision.
Hello, my name is Shelly Agarwal, Dr. Agarwal. I work here at Pronger Smith. I'm one of the OBGYNs that works here 4 days out of the 5. So the first thing to address when you are between the ages of 20 and 45, you want to be aware that the guidelines for breast exams are changing. One of the things that we always encourage our women to do is to be aware of what your breasts look and feel like. Some things that can help to prevent risks of any cancer in general, just living a healthy lifestyle, staying away from smoking, drinking, exercising. Those are all things that will really help to promote general overall health, and that will also help to protect your breasts against cancer. There's a common misconception that birth control causes breast cancer, and it doesn't, but of course those are all questions we can address when you come in for your visit. Routine screening for women starts at the age of 40. Every year you should be getting a mammogram at that age. However, there are some things that are going to make us order a mammogram earlier than the age of 40. One of those things is if you have a very strong family history of breast cancer or ovarian cancer in your family, mom, grandma, aunts, cousins, then that might make us want to do a baseline screening mammogram earlier than 40. Another thing is if you feel something abnormal, have pain, pulling, a lump, a bump, or if I feel something abnormal on the exam, then I might order a mammogram or an ultrasound to assess the breast tissue and make sure that it is normal. Although it's rare for women under the age of 40 to get breast cancer, it is something that can happen, so we of course want to address any issues that do arise. After the age of 40, same thing. Every year you want to come in for an annual exam and be screened for any issues or problems that you might be having. Pap smear can be screened either every year, every 3 years, or every 5 years, depending on your history. If a woman has had a hysterectomy and they've never had a history of cancer, or if they're after the age of 65, then they actually don't need pap smears anymore, which is nice, but you still need to come in for an annual exam so I can make sure everything else looks and feels okay. 2 cancers that can affect women, cervical cancer and ovarian cancer, are pretty important to talk about. Cervical cancer, that's why we do our pap smears every year. It's important to get screened every year, every few years for cervical cells to make sure that those are normal, because cervical cancer is very treatable and we usually catch it very early. In terms of ovarian cancer, that's a little bit more of a tricky one. Definitely if you have a family history of ovarian cancer, you want to come in and address that with your physician. So if there's any tests we can run or tests we can do to see if you're at increased risk for ovarian cancer, we can discuss different surgeries or medications that we can give to help prevent that. Some symptoms that you want to mention to your physician: if you're having abnormal bloating, stool changes, nausea, you feel like you're eating and you get full very quickly. All of those vague symptoms can be signs of ovarian cancer, so it's important to come in and get those addressed if you are having those issues. Uterine cancer is something else that can affect women. Anybody who's postmenopausal that has any bleeding or spotting should be seen right away to make sure that they don't have uterine cancer.
My name is Scott Shelley. I'm a physician assistant. I've been at Pronger Smith for 3 years now. I practice in internal medicine and pediatrics currently. Most young and middle-aged men feel as though they are invincible and do not require routine health care. This cannot be further from the truth. Preventative health care is extremely important to all men of all ages. Preventative health visits allow us to obtain baseline health screenings on all patient populations. This can be extremely helpful when treating new onset of chronic disease. As we age, it's important to know that our metabolisms do slow down. Muscle mass does decrease, and our body requires fewer calories to survive. This is often overlooked by men of all ages, especially middle-aged men. Limiting high-fat and high-cholesterol foods is important to keeping overall good health. This can be accomplished by eating lean proteins, fruits, vegetables, and whole grains. Also, daily exercise is crucial to overall good health. The recommendation of 30 to 60 minutes of vigorous exercise 5 times per week.
Hi, I'm Dr. Zachary Stender. I am a new addition to Pronger Smith MedicalCare in the orthopedic surgery department. So I think it is very important to stay in shape as you get older. Aerobic or cardiovascular activity is very important just to maintain overall health. What you can tolerate is what you should be doing. If all you can do is walk, then you should make sure that you're walking as much as possible. That's important for healthy bones and joints and just prolonging your well-being in general. So for patients who have difficulty walking, we have a wonderful physical therapy department that can help show you different exercises, but I think a stationary bike is a place to start if you can do that. The recumbent bike is an excellent choice as well if you can tolerate that. And then in addition to that, I'm a big proponent of pool therapy, in which you can get into the water and it's significantly less impact on your joints and often easier to get around and begin working on some strengthening and initial range of motion.
Preventative health care is important for mature men. Early detection is also crucial to their survival. The National Institutes of Health recommends these specific tests for men. Preventative health visits. All men should visit their physician every 2 years until age 50, and then once every year after that. Checking height, weight, screening for alcohol and tobacco use, screening for depression, and just general questions about sexual vitality. Prostate screening. Most men age 50 or older should discuss screening for prostate cancer with their healthcare provider. African American men and those with a family history of prostate cancer should discuss screening at age 45. During this screening, a PSA blood test is done. Osteoporosis screening. All men ages 50 to 70 with risk factors for osteoporosis should discuss screening with their doctors. Erectile dysfunction. Many men are afraid to approach the subject of ED. There are many causes and treatment options for this disease. Speak up and get back in saddle.
Modern mature women are smart, savvy, and sexy. Middle age is a new and exciting time for women. The nest is emptying. They're at the top of their careers, or it is a time of rediscovery. It is also the time for prevention and detection. Wise women know that as their bodies begin to change, so must their medical routine. Prevention is power. Power to make decisions that will enrich and protect your health. Breast exams. Self-examine. Women should also do monthly breast self-exams. You should contact your physician immediately if you notice a change in your breast, whether you did a self-exam or not. Physician exam. A healthcare provider should do a complete breast exam every year. Mammogram. Women over age 40 should have a mammogram done every 1 to 2 years, depending on their risk factors, to check for breast cancer. Pelvic exam and pap smear. Pap smears should be done once every 2 to 3 years. Pelvic exams may be done more often to check for other disorders. If your pap smears have been normal 3 times in a row, your doctor may tell you that you only need a pap smear once every 3 years. Osteoporosis screening. All postmenopausal women with fractures should have a bone density test, DEXA scan. Women under age 60 who have risk factors for osteoporosis should be screened. Making healthy food choices is more important than ever. As we need less to maintain, we need to make every bite a nutrition-packed meal. Eating more lean protein to protect muscle mass, more whole grains, fruits, and veggies to get enough fiber. Limiting fats and non-nutritional items will keep you fit, active, and in control of your future. Lastly, maturity affords us many luxuries. Poor diet and exercise is not one of them. You are in the prime of your life. You've accomplished so much, and you have so much more to discover. Keeping your health intact is a goal that everyone can reach. Preventative medicine will help you to achieve the best possible life. Please do not delay regular recommended screenings. Be proactive and communicate with your physician about your health. Your participation is crucial to a long and healthy life. Wisdom and maturity are building blocks to senior citizenship. Pronger Smith Medical Care is here for you each and every step of your life. We are here to help in guiding you through each phase of your life. Our staff is ready to be your partner through preventative health care. Proactivity leads to positive outcomes. Thank you.